Today I will discuss gynecomastia. Gynecomastia, or man boobs, the colloquial term, is when a man experiences visible enlargement of the breast area as opposed to flat chest, which is the most desirable for men. There are a number of causes of gynecomastia. Top on the list is weight gain, obesity. That's when we put on weight and some of the fat goes into the breast, causing enlargement. Another cause is aging. Some men age, there's a visible sag in the breast area that gives the appearance of an enlarged breast. Also, medications could do it. These will be medications typically that will enhance the activity of the female hormone, leading to breast enlargement. Some foods have been implicated in the causation of gynecomastia. Either way, gynecomastia, the enlargement is usually a result of either or a combination of the following. That's when the fat itself accumulates and or the breast tissue, the glands, mammary glands, increase in quantity or size. So that means whatever treatment you're going to adopt will have to address what the primary cause of the gynecomastia is. So in terms of treatments, the first is obviously dieting and weight loss. That will impact gynecomastia by reducing the fat component of the breast enlargement. Coupled with exercise will also tone the area, and that will be helpful in very early cases of gynecomastia from fat accumulation. The other treatment will require intervention is when you do liposuction. Liposuction will suck out the fat, but it will not remove or reduce the glandular tissue. And if the glandular tissue is a major component, then you will have to do a secondary surgical procedure to excise it, and that will mean creating a wound and a scar. Now, liposuction could be just ordinary lipo, called turkey lipo, or it could be assisted with ultrasound or laser. And either way, it breaks down the fat and then it's absorbed easily. When you do liposuction alone, if the sagging of the skin could become a factor, because if you deflate the area and the skin can sag, and that could be an issue, whereby you don't have gynecomastia, but you now have a sagged skin that looks like a flat breast. The other method obviously will be surgical excision, where you actually make a cut on the breast area that will leave a scar that you can see. Through that cut, you can remove both fat and enlarge breast glands. These days, cosmetic surgery patients require procedures that are minimally invasive, that leave the minimal amount of footprints. That's a way of scarring and things like that. So enter the new procedure, body tight. Body tight is a minimally invasive procedure that tries to capture both the fat and the mammary glands, as well as address the issue of skin sagging. So it has the advantage of having a liposuction-like invasiveness or minimally invasiveness, whereby the cut is just done underneath the armpit with tiny holes that are not visible, through which you can access the mammary area. With that, you use special prongs to discharge radiofrequency energy, which you can use to break down the fat, as well as soften and break down quite a bit of the mammary glands, as well as heat up the tissue between the breast glands or the breast and the skin surface. So what have you done with these three heating processes? You've liquefied the fat, making it easy to suck out. You've broken down the mammary glands, which means you can remove that and minimize the chance of requiring surgical resection. And then when you heat all that tissue layer from the skin surface all the way to the breast, you've excited that tissue, and when that heals, it causes a contraction of the whole area, so that the area retracts and gives you a flat chest, minimizing the chance of having an overhanging skin. So in one fell swoop, you will have killed 3 birds with 1 stone. That's the body tight procedure, a modern approach to treating gynecomastia with minimal invasiveness. Thank you.